All right, good morning. I'm
Morning.
Matt. I'm going to be your occupational therapist today. Before we begin, can I just get your name and date of birth?
Harold Johnson, 12/23/75.
All right, Mr. Harold, how are you doing today?
I'm alright.
You're okay?
Yeah.
Are you in any kind of pain, discomfort, anything I should know about?
I got some pain. Mostly in my head. I think it's from withdrawal.
Okay.
Is what they tell me.
Okay.
So,
If you could rate that pain on a scale of 1 to 10, 10 being I need to go to the hospital, 1 being very, very low.
like a 5 maybe in the
5.
middle.
Okay. Thank you for telling me that. So, I know we've worked together before. Do you remember what occupational therapy is?
Help me with like things I do in a normal day. I can't remember.
Yeah, that's pretty spot on. Occupational therapy within this inpatient psychology setting, we're going to be coming in and helping you work on functional activities to help increase the quality of life, along with working on your independence. So we're going to be going through just an outline today. I've scored your COPM that we completed recently. I'll go over the results with you there. Make sure you don't have any questions. We'll go over our goals for you and I working together, along with some activities that I have planned to work on those goals. And then a few things that's kind of like homework almost is I have a home exercise plan for you. I have 3 activities on there that will help you continue working towards the goals that we've set in therapy outside when you have free time. I've also prepared a few links because I understand you like working on your computer a lot. That's something that you're pretty passionate about. So I have 3 links prepared to send to you about it's just basically resources. If there's something in this treatment session that you have questions about, they should be answered within those 3 links that I have provided.
Okay.
The last part of our session today is going to be discharge. We're going to go over some of your discharge criteria, what it will involve, and some resources that you can access within your community once you get out of here. So this whole thing should take about 30 minutes. And yeah, I just want to make sure you're comfortable, you're good to go 30 minutes straight.
Yes, that's fine.
Okay, all right, thank you. So, we are going to go over the COPM. Do you remember the occupations that you chose when we were completing this out?
I think grocery shopping, house cleaning.
Yep.
Finding a job.
Yep.
And then preparing my meals.
Good, good. I'm glad you remember that. So we had you perform grocery shopping, cleaning, searching for a job, and meal preparation that last session that we had. So I ranked your performance as a 2 for grocery shopping, a 1 for house cleaning, a 1 for finding a job, and a 2 for meal preparation. And those scores differed a little bit from your satisfaction. For the most part, your satisfaction was a point or 2 higher on most of those occupations compared to your actual performance. And you had indicated that you have some pretty high goals for those activities, ranging from a score of 7 on a scale of 1 to 10, 10 being the most important. So that's good. I'm glad that we were able to identify some of those occupations. But based off of the scoring and satisfaction, overall, the maximum score since we have 4 occupations on a scale of 1 to 10 each, is a 40. 4 times 10 is 40. You scored a 6 out of 40 on performance and an 8 out of 40 on satisfaction. So those are some areas I think this is where the COPM shines as an assessment, because we're able to select these activities that are meaningful to you, and we're able to address them and analyze them as occupational therapists and work together with each other to make sure we're spot on with treating meaningful activities for you.
Okay.
So with that score of performance, 6 out of 10 being low, we created some goals together to address that low score along with the satisfaction. But I just wanted to go over this assessment with you to make sure that we're on the same page of where our beginning benchmark score is. Because we'll be taking this again in about 4 weeks.
Got it.
Okay. All right. So the first goal, the big overarching long-term goal that we had put together was in 4 weeks, you will get a 12 out of 40. So 12 out of 40 coming from that 6 out of 40 on the COPM. And that's important to us because the COPM, since we're addressing occupations, meaningful activities for you, it'll help increase your independence when you get back home.
Okay.
Now, for our 3 short-term goals that will are created to make sure we're on track to completing that long-term goal in 4 weeks, is in 2 weeks, you will be educated on the various vocational services that are out there, things like LinkedIn, Google search, to find employment, because I understand you've been employed for quite a while.
Mm-hmm.
Okay. And we're just going to make sure that you have enough tools within your toolbox, so when you do get out of here, you're able to get back into the community and begin working to make sure that you're taking care of yourself as well.
Okay.
The second goal that we talked about was how you will initiate showering and bathing on your own. I know that you haven't taken a shower in a little while coming in here. Was that something that you had trouble with before you were admitted?
Yeah, I just forget, or I don't have time for it, or
Yeah.
it never comes up.
Yeah, you just forget sometimes. I understand. This is, I think showering and bathing is important to address as a goal, because that's going to affect your ability to find a job. The way that you present yourself is important, and take self-care as well. So that's why we have that as a short-term goal.
Okay.
The last short-term goal is in 2 weeks, you will initiate and complete brushing your teeth for at least 2 days in a row. I understand, just like showering or bathing, you've had kind of an inconsistent streak with brushing your teeth.
Yeah.
Yeah.
Mm-hmm.
Okay. So, I mean, I'm glad that, you've had the transparency with us to talk about that. And that's something that we're excited to work with you on, because, that's important. We want to make sure that you're staying healthy with your dental hygiene as well.
All right.
Yeah. All right. So I have a few activities prepared to begin. The first activity that we'll do is called motivational interviewing, MI for short. And the purpose of MI is it's the counseling approach. So this helps people explore and resolve ambivalence about change. And it's a collaborative process between you and I. So it's going to be staged as almost us just having a conversation. So I want to make sure that when we are having this, please feel free to let me know if you're starting to feel uncomfortable. If you want to avoid a specific topic, that's totally okay. This is just our benchmark session. So this is our starting point.
All right.
So the next activity that we will do is called reflective journaling. Are you familiar with journaling?
Like a diary or something?
Almost. Yeah, very, very similar. So journaling is it's a reflective process. So I'm going to provide you with a notebook, and you're going to be responding to a prompt that I have for you. It shouldn't take too long either. I know this treatment session is going to involve a lot of reflection and deep thinking, but I'll have 2 questions for you, and you'll just respond to those.
Okay.
And the last activity that we'll be doing is a supervised hygiene practice. So we're going to provide you with a toothbrush, toothpaste, and I'm going to watch you brush your teeth essentially. If you need help, if you need any sort of cueing, I'll provide that. But if not, please complete it to the best of your ability.
Okay.
So going back to MI, it emphasizes open-ended questions, so you're going to be talking the most of the time. If you're just killing it and we think that, you can get more out of it, if we upscale, make it a little bit harder, I'll continue to ask more open-ended questions. If not, and our conversation is getting a little stalemated, I'll scale the open-ended questions back and ask more direct style questions. Sound good?
Okay.
All right. So to begin motivational interviewing, after our last session, I got to know you pretty well. May we talk about the substance abuse?
Yes.
Yeah. First of all, when did you begin using substances?
Long time. I can't even remember.
Can't you remember?
Since I was a kid or something.
Okay. Do you remember kind of where you were at? Maybe where you were when you began taking substances?
I think I stole I think my first thing was stole a cigarette,
Okay.
and then I was hiding it, smoked it in the back of the house.
Okay.
That was the first thing I ever did, I think.
That was the first thing you ever done? Okay.
I was like a little kid.
Okay, yeah, thank you for sharing. How much or what do you know about some of the negative consequences of smoking?
It's not good for you.
Yeah.
Bad for your breathing and your health.
Mm-hmm.
It's addicting.
Yeah. What are some positive things? What are some things that you enjoy about it?
Makes me feel good.
Yeah.
Allows me to take a break and relax.
Okay. Yeah. Do you find, or do you think that there's any other way that you can find a way to relax, enjoy yourself?
I like fishing.
You like fishing?
Yeah.
Okay. What is it about fishing that you enjoy?
Just being out with nature, and it's quiet.
Yeah. You enjoy the peacefulness.
Yeah.
Do you like to go and do that with friends, family members, or do you go by yourself?
Used to go with my dad, but now I just go alone.
Okay.
If I ever go.
Okay. So it sounds like you need an outlet. You need something to do.
Yeah.
To kind of get you away from the bustle of life, right?
Yeah.
Okay. Yeah. Thank you. I appreciate that you're willing to share this much with me, because I know some people are really, really negative about addiction. So I think it's a great step that you're open to talking about it. But how would you feel kind of redirecting the conversation? How would you feel about change, potentially replacing smoking with fishing, for example?
Well, I've since upgraded to a lot of different drugs and alcohol, and I don't know if I can just turn it off. It's been a part of my life for a long time. But,
Okay.
I mean, I'd like to change, I guess. It's not helping me in my life much. So
Okay.
I'm open to it.
You're open to change.
Yeah.
Okay. It sounds like you're open to thinking about it, maybe just not making the full commitment to action yet.
Yeah.
Correct. Okay.
Yeah, I keep making mistakes and going back to it, but I think I want to.
Okay, that's a great starting place for us to begin treatment with each other. The purpose of this interviewing conversation is just to help you realize that where you are with change, how you view change, not necessarily to make you feel like you need to do something right now. Yeah, so I think that was a great start. Moving into the next activity, we have reflective journaling right here. You've got your notebook, and I have a question for you to answer. Can you tell me 2 positive things about change and 2 negative?
Write it.
Yeah.
2 positive things. Better relationships. Better health. 2 negative. It's hard. And then I have to change my lifestyle. Change it. Stressful. Is that the same thing? Or is that different? Is that right?
I think that's great. Would you feel open to reading your responses in like a full sentence? So saying, 2 positive things that I feel about change are.
2 positive things about change are better relationships and better health.
Good.
2 negative things about change are that it's hard and it's stressful.
Good. The purpose of this activity is to create and promote some self-awareness to how you are feeling about change. Very similar to the other exercise, motivational interviewing, that we just did. But with this, you have the writing down portion. It requires you to sequence and plan some of the thoughts that you're having. So I think that this is a really good benchmark for us. And it's good that you're able to, communicate that with me on paper, And I think if this activity begins to be super easy or it begins to be more challenging as treatment goes on, there are some ways that we can scale this. So making it harder, we can up this to 3 times a week, so we can have a different prompt 3 times a week. And then if we need to scale it back, we can just switch it down to 2 times or 1 time a week with the same prompt. So that way, we're able to match the challenge of this activity to where you're at. All right, this last activity is going to be our supervised hygiene practice. So right here, I have a toothbrush for you. I have some toothpaste. And I'm just gonna ask you to brush your teeth. Show me how you brush your teeth. Okay. Is do you tend to brush your teeth without water?
Yeah.
Yeah. Okay. With water, it makes it a little easier to brush, and it spreads out the toothpaste a little bit longer. So we have some water right here. Yeah, there we go. Yep. And then while you brush your teeth, you usually want to do it for 2 minutes. You don't need to do it right now, but moving forward, just make sure that you're brushing for that amount of duration, and I'll be here to cue you if anything need be.
Okay.
Yep. And the goal to make this is to make you or help you establish a good routine with hygiene, because that was one of our short-term goals. A few ways that we can make this harder is I can give you less verbal cueing, directions while we're doing this activity together.
Yeah.
And a way to make it easier for you if it is challenging for you, is to give you more verbal cues. So that's how we'll go about treatment process moving forward.
Okay.
All right, so that is our activities. You did a great job completing those.
Thanks.
What we're going to do now is I'm going to go over your home exercise plan. So once you get discharged out of here, I have 3 activities that are very similar to the activities that we just did.
Okay.
But it's going to be, since you're out and about and you have access to the community, it's going to involve that as well. So the guided journaling, I think, is something that is really beneficial to everyday life. So I have that on the HEP. I want you to do that 3 times a week. And if it's something that just becomes routine, very, very easy, you can up it to 4 times a week. If it's something that you're challenging and it's hard to meet that 3 times a week quota, decrease that amount to 2 times. The next one is we need to start getting you to exercise. During our last session, we got your occupational profile in an interview, and you're 5'9", 270 pounds, and the BMI, body mass index for that, is pretty high. That means that you're a class 2 obese classification. So just to prevent future health implications, we want to get on top of that. So I have some cardiorespiratory exercise in here. So we're just going to begin with 3 times a week, slow cardio, 2 times a week, 4 30-minute sessions each. We're just going to do a short walk around your neighborhood. And as you get more accustomed to that, it becomes easier. We'll up it to 2 times a week for 30 minutes with a slow jog.
Okay.
If it's hard for you to meet that base starting point of 30 minutes,
seems like a lot.
It is. You will just decrease it down to 2 times a week, 20 minutes each session.
Okay.
All right. And then the last one is some mindfulness meditation. This one is really easy to do, especially right before bed. It can help you get an improved quality of sleep, along with you being just a little more in touch with your body and your feelings, your thoughts. So we're going to start there with 3 times a week, 5 minutes each session. And the way to make this more difficult or to meet where you're at if you're improving is to up it to 3 times a week for 8 minutes each session. And a way to make it a little bit easier if you're struggling to meet that baseline is 2 times a week for 5 minutes each session.
Okay.
All right, and some educational materials that I have that'll go home with you. They are links. It's going to be the first one, and it's called What to Know About Mindfulness Meditation. So if you want to do some more research on your own, I have this link here for you, along with link 2, motivational interviewing. We went over that as one of the activities we do together in treatment, and that's just another sample for you if you want to do some research. And then the last one is benefits of journaling. So if you had any questions about journaling that I didn't address here, you can refer to that. All right, and for our discharge, we have a few areas that we think that will benefit you once you get out back in the community, get back home. The first one, or I guess the first step, is to meet all of our long-term and short-term goals that we established within this 4-week time period of us working together. So we need to make sure we check all of those off. The next one is going to be, after those goals are completed, is I have a website link that is a resource for you that is called the Alcohol and Drug Awareness of San Antonio Council. And this is a group support system, and it'll provide you a resource to get in touch with other people who have had similar experiences as you.
Okay.
The next one, because it's important to address the biology, the mind, the emotions as well, is a Alcohol Anonymous supported group exercise program, and that's local here in San Antonio, and it's a free citywide program where there's a lot of peer support. So something that we can help help get you involved with and start, helping you build positive health health habits that will increase your, you know, quality of life down the line. And then the last place is a outpatient psychology counseling service. Just, once you get out of here, if you need to talk to someone, if you're having trouble with relationships, I know we talked about previously your family, you're no longer in contact with them. If that's, if there are areas that you would like to address and you just want to talk to someone about, maybe get some insight, that's a great resource for you.
Okay.
So that concludes our discharge. I know we went through a lot of material. Is there anything that stands out where you have a question? Is there anything that you would like me to address for you?
No, I don't think so.
No?
I think I got it.
Okay. So again, the goals that we established here in treatment are centered towards you. We made them together, so I'm really looking forward to working with you and making some progress.
All right. Thanks.
Yeah.